been a manufacturing base in this country. And if this community is out trying to capture an automobile manufacturer in El Paso County, right now American car manufacturers are paying $1,800 per car more than Toyota, because Toyota has the bottom line is paid for in healthcare costs by government-sponsored Japanese insurance. And you go into GM, GM is paying $1,800 a car in legacy costs of health insurance policies for folks, and you can't compete. That's why I think if you're looking at El Paso, Texas, in terms of the business case for doing it, this is one place where we ought to be stepping forward to say, let's do it, and let's do it now. Let me walk through some of the things that are happening here in El Paso today for various reasons. If you look at the most expensive hospitals in the United States, 8th most expensive is in Brownsville, in the medical center there. The 37th most is Sierra, and the 46th most is Providence Memorial Hospital. This hospital is the most profitable hospital in the tenant chain nationally. These are costs of different hospitals with respect to cardiac care. So what you're looking at is a bar graph that shows what the costs would be if you went into different units here and got a cardiac care for a typical profile of someone walking in and having chest pains and is being put under different kinds of surgeries to take care of it. This is a bill that was brought to me last week by a good friend of mine who checked in the hospital with heart pains, was there 2 nights. We blacked out his name because he really didn't want me to give you his name. This is the total charge for being in the hospital for those 2 nights, $101,456. The adjustments were $93,069, and what was left to be paid, what was paid actually by the insurance company, was $7,333. The total charge, the adjustment, and finally, what was negotiated and actually paid by the insurance company, the catheter by itself was $6,000. Now, let's talk a little bit, because we've got about 10 minutes to answer your questions. I'm going to tell you my position as a citizen, because in this one I don't have a vote. This vote is by our congressmen and our U.S. senators on bills that are up there. I filed at the state level almost identical bills to get people covered with health insurance in El Paso, Texas. They didn't pass over the last 2 sessions. I filed bills to expand the CHIP program to 80,000 more kids in Texas that would be covered by it. I've fought for 10 years to increase reimbursement rates in clinics like the ones that these guys serve in, so that they can have a competitive medical staff and pay them. And today we're doing everything we possibly can to attract and retain more doctors and more nurses in El Paso, Texas, because that's the challenge of the day. Last session we were successful at passing a bill that said if you serve in one of these underserved counties and you're a doctor and agree to stay there, then we're going to pay back your health, the cost of your medical school over 5 years if you'll agree to stay in these areas. That's law in the state of Texas today, and I am very proud of that bill. So I'm telling you where I stand as a citizen. I don't have a vote on this, but if I did, I would urge every single one of my colleagues to move through and get a bill passed, because this historic moment should not pass us by. I wanted to share that with you. I wanted to bring this information. You have an FAQ, frequently asked questions sheet back there. I'd urge all of you to take a look at the information in there. We've got about 10 minutes for this part of the coverage, and then we're going to turn it over to the real experts so they can talk about pieces of it. I appreciate you coming. Yes, sir.
I'm coming around, Senator. I'm right
We're
here.
going to bring a microphone to you.
Yes, sir. If you'd stand up, please. Sir, what is your name and what is your question or comment?
Right, my name is Donald Derryberry, Upper Valley, El Paso. And let me read my question, because I am an independent, I guess, because the past few years I've voted Republican. Before that, I voted Democrat.
I do want to ask you all, please, to try to keep your comments and questions to about a minute so we can get as many people on as possible. We've only got 10 minutes. Thank you.
sometimes I wish there wasn't any political parties so Congress could vote for what their constituents need rather than their party. But what I wanted, we're not objecting to health care. What we're here is asking some questions about that original bill. Now, we don't know whether it's been corrected. As I understand, you have not arrived at a final bill yet. Is that correct?
Yes, sir. Now, that bill is the bill that came out of the House committee. It's not even passed the whole House yet. And it's the one bill that's live. It's the one bill that's out there being discussed. The Senate side is developing their own bill. So right now we're talking about concepts. What concepts would the American people support, and how can we solve it?
So what is your question, sir?
Okay, this I hold in, wait, this, let me just take a second for my question. This I hold in my hand. This was done by the Liberty Counsel, a law firm, about the original bill, in which items they said certain things were wrong with certain items. This is another one put out by well, anyway, it addresses what Liberty Counsel says, and says they're wrong in most cases, or they incorrect or not complete. So my question is, if you go ahead, if attorneys can't decide on how to make each question in the bill, and you pass it that way, the people running the program can interpret it any way they want. So why are we in such a hurry to vote on something until we get these questions straightened out?
Well, I think you're raising a real important issue, which is we ought to know what every single word says, and we ought to put that bill out so the American people support it. When the Social Security bill was passed back in the mid-30s, I think it passed with 16 votes of Republicans that were votes that people felt strongly about when the country was in a depression at that point in time. And I think for this bill to have broad, lasting impact and support, there's going to need to be broad support across party lines. I believe that. And what happens with these bills, and I've been in the room with hundreds of them in Austin, not in Washington, is that you negotiate pieces of it based on concepts. So these are the working concepts. What has the president said? Got to lower health care costs because you can't sustain that level of spending. It's costing too much money for the outcome that we're getting. Move to patient outcomes, not profit. Second, we're going to cover every American. It's the right thing to do. Everyone's doing it. Third, we're going to understand how we're going to pay for it. That's what he said. And so these concepts are what are moving through, and I think you're going to see it change quite a bit. There'll be a bill that comes out of the House. It'll have A, B, C, D, E, F. There'll be a bill that comes out of the Senate. How many are you going to have to get in the Senate? Most cases you want 60 to avoid a filibuster, and you really ought to have 60, but there's a rule that was passed about a month ago that says we could do it with 50 if we need to, a majority of the 100, and then these two bodies negotiate. And this bill is different from this bill, so they got to match them up, and then they got to take them back to this House, back to the Senate, and vote on it, and then that bill, the conference committee report, then goes to the president, and he has the opportunity to sign it or not sign it and veto it. So we're a ways away from where we're going to get a bill on the table, but I think the important part right now is hear the concepts. What concepts do we absolutely need in this bill, and what do we believe in? And I appreciate you coming and participating, sir.
What is your name and what is your question, please?
Gio. And the first thing I would like to ask you, Senator, is how all the people in the U.S. can help to make this an easier process and quit putting up with all the chaos that has been initiated by other parties other than the Republicans. And the third is, how will the insurance be a part of these issues, because they're very wealthy from the money that they take from us. Thank you, sir.
Well, let me ask you two questions there. And first of all, I want to thank everybody here. I don't know what's happening in other parts of the country, but this is not chaos. This is people that came to talk about it and want to get something on the table and solved. And really, that's when America's at its best. Let's bring these ideas, let's talk about them, let's get them resolved, but let's move forward. Let's solve the challenge. Let's get people health care. That's the message I think we need to take. If you want to be a part of this process, you're doing it by being here. These ideas, this is being filmed right now. This is being sent up to Washington, D.C. The list of questions that you're raising, we're going to compile and send to Washington. And I'm taking these ideas to put in bills in Austin. States have solved this issue without having to go to D.C. Massachusetts, Hawaii both have universal health care bills. My view is that we're here tonight to discuss it and make history happen in America. And you're already doing it by being here. Insurance, let's talk about it. It's an important part of this thing. What happens in insurance? And I think insurance is going to be part of the discussion. You saw how much of the pie is done by commercial private pay insurance. Let's be very honest about how some practices occur. Folks get knocked out of insurance policies. They get knocked out of coverage in order to maximize profit. Not everybody does that. Some of them do it. I had 6 bills last session to stop that practice. Let me tell you about one of them. Lady goes in, is diagnosed with a terrible form of breast cancer. Someone in an insurance company is being paid a bounty to check the application against the disease. They go back and they find that she's been treated for acne in high school. She was then removed from health care coverage for lying on her application when the acne had nothing to do with the disease that she had submitted the bill for. How many here would like to see that practice? It's called rescission. How many here would like to see that practice stopped? That is wrong. It is a deceptive practice. It is not right. That's one of the things that's on the table up there. I'm going to tell you, I got all of those bills out of the Texas Senate, and they all died in the Texas House. And you go over there and say, what in the heck happened to this bill? And that's about the time the lobbyist runs out the back door. But that's how it works. And I think insurance companies are part of what we have to talk about and part of making sure that this works, especially in the allocation of resources. You saw that the insurance company went through that bill and hammered pretty hard on reducing the cost of that. But when that cost of that bill, the balance of it sent to the customer, what's the customer supposed to do? That's a problem, right? Yes, sir.
Sir, what is your name and what is your question or comment?
Yes, my name is Ben Mendoza, and Senator, thank you for facilitating this meeting. I also wanted to ask you if in any of your bills, and from what I've read of HR 3200, they do not include naturopathic care, whereas the bill is pretty much allopathic care. Do you think that maybe that should be included as an alternative as well?
You know what I'm going to do? I'm going to punt that to the experts. He's talking about different approaches to medicine, when you can use certain types of natural approaches. And certainly that has a place and has long had a place in medicine, especially in this part of the country. I'm going to ask these experts to address that because they're on the front lines of who's coming in and what works in different parts of the community. So let me get them to answer because those are the pros. I'm just a $600 a month senator.
I appreciate it, and thank you very much.
You bet.
Do you want to allow them to address it?
Well, let's get them down. If one of you will make a note of it, and then we'll get the question back up there.
What is your name and what is your
My
question,
name is
please?
Victor Cárdenas. Thank you for the opportunity to have a conversation on this important topic. My kind of following, without being coordinated, the comment, a lot of the discussion actually has been prevented by the level of attacks made on the bill without knowing the facts, and I think it's very important to hear what are the backbones of the proposal. However, I think that one of the key problems of the healthcare system in the US, as you have said, is that we pay way too much for what we get. In my mind, it's not a question, it's a comment. I think that we shouldn't pay for things that don't work. Healthcare for all, but effective healthcare for all. And I want to hear your comment and probably follow up later with the experts in what should be in place so we don't have so much waste, so much variation in treatments that probably don't make a difference. And it seems like I'm against healthcare, but reform, no, I'm for, except that it's probably short.
Okay, sir, let's let the senator comment.
Well, let's talk about that because the president's talked about this a lot. And the issue is this. Broadly speaking, do we take a model that has to do with patient outcomes, where preventative care has a real role, where what works in a community, what works and we know works is adopted? Or do we take what's evolved as the for-profit model, where there's an incentive to create a referral for a test really about profit and not about the patient's outcomes? And when you read some literature, you'll see here's the Mayo Clinic model, or one of the clinics that these guys serve in, where they build a team around the client and the patient and say, okay, how can we improve your outcomes for diabetes? And what part of it can be dietary, and where can we get counseling for you and get you access to good food? What part of it's really solid dialysis that we're going to have to do in the future and make sure that we make the right decision for you? The other side of it is this for-profit model where you've got referrals, 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 built-in costs, and the idea is to max out the cost code for that particular procedure, and then you see bills like that. When you got a $101,000 bill for spending 2 nights in the hospital, and taxpayers are being asked, what are you going to do about that bill? That's what the president's talking about when he's saying, look, when you're in Britain, they're spending half of what we're spending and getting better outcomes on mortality, diabetes, neonatal, all the key indicators, because they've done it from the standpoint of the patient and not profit. So you're going to hear a lot about that discussion, and these guys will have a lot of insight to offer.
Eric, please help me stay out about a minute on the questions and comments. That way I can get as many of these people on as possible. Yes, ma'am. What is your name and what is your question?
Yes, my name is Irma Carrillo. And my question is, I know that one of the concepts is requires all Americans to have health insurance, but we know that CHIP has been a collaboration between federal and state government. I haven't heard anything, an explanation of how CHIP would be rolled over into a federal government. How would that incur any savings for states? We know that there's a wide variation between the implementation of CHIP, Texas being a prime example, as the last legislature showed. How is that going to be rolled over into this new national model?
You know what? I can't tell you, because it's going to be 2 months, 6 months out. There'll be a lot of negotiating. Generally speaking, what they're saying is let's take the programs that are working, the programs that have low-cost administration. The administration on Medicaid, Medicare is about 5 cents. The administration on Blue Cross Blue Shield is about 28 cents of each dollar. And so they want to take the programs that are working and then meld them together where you cover more people from the bottom up. If you look at the last one there, you're talking about getting subsidies up to $88,000. That's a huge jump in El Paso. And then taking those that have coverage that they like, insurance coverage that they like, employer-based or otherwise, and making that portable. So you can take it with you and you have a choice of what you want to keep. Those are generally the concepts that are coming out in DC today. So I can't tell you, maybe they've gotten more current information, but I think what we're going to be looking at is a lot of changes for several weeks now. We're not going to be able to answer your question.
What is your name and what is your question?
3-part question, please.
What is your name, sir?
Number one, does this bill address the nurse-patient ratio? And if it does, are there requirements for the hospitals to comply? And if there are requirements, are they going to be stiff enough to make the hospitals comply?
Are you a nurse? You know what?
For 40 years, and my daughter is a nurse at one of the hospitals, so I'm well educated on the nurse-patient ratio. It's dangerous.
It sure is.
And it should be addressed.
You're
in
exactly
this
right. Let's talk about the issue he's bringing up here, okay? You're on a ward of, say, a pediatric unit, and what you learn in medical school and nursing school is the ratio ought to be 1 to 10. So the nurse can have enough time to walk in here and make sure that this preemie is going to get the care that they need and monitoring them on every 20-minute schedule, right? You learn that. You learn it in medical school. You learn it in nursing school. It's a standard. 1 to 10. What's actually happening? To save costs, to save money, to make that ward more profitable, that ratio turns into 1 to 20. What happens to the nurses? These guys go crazy. They can't do it. They can't keep on top of the care, and mistakes are made. And what happens is you've got more profitable care, but more dangerous care. Now, certain states have gone to mandated ratios. You walk onto that floor, here's the ratio, here's what you're going to have to do. In Texas, I worked real hard on a bill about these ratios to set up committees in hospitals where nurses were monitoring those ratios to make sure that the ratios are observed and that the hospitals are doing it. That bill's effective September 1st. Did we get everything that we wanted? We didn't. Is it an improvement over where we were last year? It is. And that's all I can tell you on the nurse to patient ratio. It's an important aspect of good care, that ratio, because you can see that if you get fewer and fewer nurses and more patients, you just don't have the time to do what you need to do for each patient. That's especially true in trauma, critical care, and neonatal units, pediatric units.
Sir, what is your name and what is your question?
Sir, my name is Ernest Alvarado, and you talked about BRAC a while ago, about BRAC, and my concern is with the VA here in El Paso, okay? It is one of the most piss-poor place I've ever been to, okay? And I mean, really, it is, right now, I am really irate on things that are going on over there. Last year in April, there was a thing on the newspaper where it was the worst in the nation, okay? It hasn't gotten any better. As a matter of fact, in the last couple of weeks or so, a lot of the veterans, we have been actually told that the home care that we get has been cut in hours, some of us to be left without any assistance at all. And as you can tell by just looking at me, I'm not able to get up and take shower, do things on my own. So they've cut me where I'm actually need to lie in bed by myself all day because I live on my own, okay? By myself just because they're talking about a budget. You know,
What would your question be then?
What are we doing as far as looking at the VA? You know, I mean, management there needs to be addressed, staff needs to be addressed. You talk about the veterans, I keep hearing that they're taking care of the veterans. I don't see it happening.
I'm going to tell you my opinion about that. If this great nation is going to go to war, then let's take care of our veterans. Let's just do it right. And let's do it when we send them to war, and let's do it when we bring them back. And I here want to thank you for your service in front of everyone here. What's happening in the VA? What's happening is cost cutting. And who's paying the price? You are. What should we be doing in this community? Remember how we made it a goal to get a medical school here? Remember how it became the thing that everyone was fighting for and we got it done? We need a full-fledged VA hospital in El Paso like they got in Waco and like they got in Albuquerque, so the full range of care can be provided to the veterans that are here. Fort Bliss is going to be one of the biggest DOD bases in the world. It's crazy not to have it. Let's do it. That's my advice. That's, I think, what we need to do. And I'll tell you what, Ciro Rodriguez, who is the other congressman from here, will be here Monday. And I think those of you for whom this is the top issue, I passed a Senate resolution in Austin. This is a DC issue. This is a Department of Defense budget. But we passed a resolution to make it come to El Paso. But to make it come, you got to bang on the doors and you got to say this is important and we got to make it happen. And I am fully in support of you and making it happen, but it's going to take every one of us making the case, asking the questions, and supporting exactly what you said to make it happen. I'm going to give these guys their time, and I'm a little bit over now, so this is going to be my last question, sir. For the rest of you, I'll be glad to go and answer your questions back there while the panel's on, so you get your questions answered by me, or we can do it after the event. I will answer your questions, but to give them time and respect their time for coming tonight, let's make this the last question.
My name is Bob Strong, and I called Congressman Reyes' office about 3,200 to find out if abortion was in there or not. And they told me it's not. But I thought their answer was deceptive because I found out later from other people there aren't any benefits in 3200, and that the benefits are going to be defined by the Secretary of Health. And as you know, the Secretary of Health, Kathleen Sebelius, she was in bed with George Tiller, the baby killer. So in a backhanded way, I think this thing is very deceptive in that all of the benefits, including abortion, are going to be defined by the Secretary of Health's department. And it's deceptive, I think, for people to say that abortion isn't in 3200 when it's going to come in through the back door. So
it seems to be a reoccurring theme, Senator. Are there safeguards to make sure that there is no funding there for abortions?
When the president says we will not put it in this bill, and it's not going to be in this bill, when people in the Senate that are leading it, like Max Baucus says it, and what they're doing is counting votes, I'm going to tell you how it works. And there's a sizable set of Democrats who would not support that. My belief is that it will not be in the bill. And I urge you to keep watching it. And the reason it won't be in there is because it'll attract so much attention that it'll lose votes on other matters in the bill that are the president's trying to get done. That's my prediction politically. Now, can I promise you? I can't promise you. What I ask you to do is continue to watch it and continue to ask about it. I think politically, that's not the center of what is the thrust here, what we're trying to get done. What we're trying to get done is to get people health insurance in this great nation. That's what we're trying to get done. Let me take a bow here and thank you all. For those of you who want to ask me any questions, I'll be out there. I want to thank these guys for making time tonight, and thank you, Joe, for making this happen.
Absolutely, Senator. We'll now go to our panel of healthcare experts. If you all would like to chime in on this issue, we'd very much appreciate it. Dr. Luna, we'll start with you.
Well, thank you. Thank you. I've been practicing medicine for 27 years, and actually I've been working for healthcare reform for all those 27 years. I want to speak to you tonight about my ideals and why I think we should have healthcare reform. I want to talk about two issues. One is an economic issue that affects all of us, and the other issue is a moral and ethical issue to do this. From the economic issue, I'm not going to talk about the fraud, the abuse, the overbilling, Medicare Advantage plans, etc. For the economic issue, I'm going to talk about something called uncompensated care, and I'm going to talk about readmissions in Medicare. In a 5-year span between 2001 and 2006, uncompensated care in Texas increased from $5.5 billion to $11 billion. That's a cost of people who go to the hospital and don't pay their bills, either because they can't or they don't want to. It's just uncompensated. Unfortunately, all of us continue to pay for that. Directly related to this is that our family premiums, the premiums that we pay, a small business pays for health insurance, has gone up by about 50%. The average premium for a small business for a family is up to about $13,000, which is way above what most of us can afford. The other issue, and I see a lot of us who are near the Medicare age, is that, I don't know if you knew this, throughout the country, Medicare patients have readmission rates are about 20%. Within a hospitalization, that means that when you go to the hospital and they treat you and they let you go home, you're back in the hospital within 30 days.